Hello, class. My name is Dr. Kennedy Paron, and we are going to go over Chapter 4, Section 3, Birth Problems. So first, we're going to ask, what are the effects of oxygen deprivation during birth? There are two types. Anoxia refers to the condition of a lack of oxygen, and hypoxia is a condition in which there is less than the oxygen required, but they're still getting some. So the fetus may not develop their central nervous system, which will lead to cognitive and motor problems. Examples are they might develop cerebral palsy, psychological conditions and disorders, or early onset schizophrenia. This schizophrenia is a serious psychological disorder characterized by breaks in reality, seeing or hearing things that are not there, called hallucinations, and having fixed irrational beliefs or delusions and disordered thinking. So the effects of less oxygen or oxygen deprivation on the fetus is very severe. So facts about premature birth. 7% of American births are premature babies. If a baby is a multiple birth, meaning a twin, triplet, or greater, so more than one baby at a time, their chances of preterm birth actually rise by 50%. Babies with lower birth weights also come with premature births, and they have an increased risk of dying as well, unfortunately. So oxygen deprivation due to the mother. So if the mother has diabetes, for example, it can lead to oxygen deprivation for the fetus. This can cause pressure on the umbilical cord, is another one that is another cause of this. If there's pressure on the umbilical cord during the birth, it can also lead to oxygen deprivation. Breech births or breech presentation of the baby can also lead to anoxia. Breech means a position in which the fetus enters the birth canal with its bottom first instead of its head. So what interventions do we have? Fetal monitoring is very important in order to detect anoxia. And if the baby is in distress, a C-section is always an option if it can help the mother to better the health of the baby and the mother if it is needed. So what are the risks of being a preterm birth or a low birth weight? So prematurity and low birth weight go together hand in hand. Preterm birth is anything before 37 weeks of gestation. Babies 5.5 or less pounds are considered underweight. And small for dates is a descriptor of neonates who are unusually small for their age. So what can cause higher risk of low birth weight? Mothers who drink and smoke and consume drugs, as well as mothers who do not receive adequate nutrition during the pregnancy are at higher risk of low birth weight. In the next section, we're going to talk about 4.4, postpartum period.